speaker today is Dr. Andrew Whelton. Dr. Whelton is an associate professor of civil engineering and environmental and ecological engineering at Purdue University. His team investigates and solves problems that affect our natural and built environments. His expertise focuses on environmental chemistry and engineering, disasters, water quality, infrastructure, and public health. Dr. Whelton holds a BS, MS, and PhD degrees in civil and environmental engineering from Virginia Tech. Dr. Whelton has contributed to the discussions of COVID-19 related building closures and the impacts on our distributed potable water quality. Welcome, Dr. Whelton.
Thank you. Thank you for having me. So I was asked to share some insights about water safety and how we can know if the water that we're using in shut down buildings or buildings that have gone to low occupancy is safe. And that was a really challenging question that kind of precipitated early on in the pandemic as a lot of social and physical distancing occurred. Next slide, please. And so just to kind of set the framework here, many of us work and live in buildings, and we work in homes, we work in big commercial buildings or multi-use buildings that maybe have multiple floors. There may be multiple tenants in a building, or you might have a doctor's office, some apartments, a dentist's office, and a restaurant. And the complexity there is that each of those building users uses water differently. So they may have different pipes, they may have different needs for hot water, different lengths of time when they're using the water. You know, during the day, the restaurant would be using the water, whereas maybe at home, you wouldn't be using as much water. And in this challenges water safety at the faucet, because that means that the water may age differently inside the building, in different parts of the building. And much of this water is in the US delivered by what's called public water systems. So these are regulated entities that either get the source water, they treat that water, or they just simply distribute it to their population through buried pipes and tanks and the like. And so when the COVID pandemic hit, many questions came up about, well, how do we know that if you leave a school stagnant, where the water's not moving at all for 5 months and you go back, that it's safe for kids and adults to be exposed to? And so that led us to question the science, state of science about heavy metals and pathogens in the water, which are primarily the risks that we're concerned about. Next slide, please. But, you know, the COVID pandemic, and even before the COVID pandemic, we were concerned about building water safety from a disaster perspective. So we're all familiar with the wildfires that are happening out in the American West right now. Many of the buildings that are left standing sometimes have contaminated water being delivered to them because the water distribution system, the hydrants, the tanks, the valves, the meters have been contaminated. And one of the questions that is afflicting these communities now is, how do you know how to determine if building water is safe? And where do you sample? How do you sample? What do you look for? When's enough? And you're seeing different states take different actions. Recently, the state of Oregon has done some great work where they've kind of upgraded some of the failures of a policy that was developed after the Camp Fire in California and addressed some of the nuances with sampling water. Now, why that matters is, next slide, please. After the COVID pandemic struck, and a lot of questions came up about building water safety, there were a number of different federal agencies, state agencies, nonprofit organizations, companies, consulting companies, generating their own guidance on how to make building water systems safe. Some of them were, all of them I think were well-intentioned, but many of them were detached from reality, detached from science and the state of the science. And so, you know, where we are, why did we do that? Why did we see that? Because there's a disconnect between the data and the evidence and the people that implement policy. And so that's one of the challenges that we're seeing here. We really need to take an approach, which is exciting, to make transformative change with regards to advancing public health. We need to have science and engineering. We need to have policy, adoption, and buy-in, and it definitely has to be driven by and supported by the community. Next slide. And so, together, what we have done is we've worked with a number of different institutions after disasters or during, in response to this pandemic, and generated and helped generate documents that pertain to the state of the science about building water safety and some of the health risks that we're concerned about with regards to stagnation. And then the American Water Works Association published a how-to guide on how to basically evaluate building water safety. And so with that, I'd like to say thank you very much for the opportunity to be here. And we really need a whole bunch of disciplines to participate and help us kind of advance public health forward.